now.
This is our GT1000 group project featuring Sam, Anika, Matthew, and Maya. (911), what's your emergency?
I just found my husband passed out in the bathroom and there's blood in the toilet.
Josh Wright. Josh Wright is an EMT paramedic based in the Atlanta area. He became a EMT paramedic because he really wanted a degree in the healthcare field, but first wanted to operate as an EMT while he was in school to make extra money to work his way through school. His job he wants to get when he's older is a general practitioner, but that is after school. The median salary for an EMT practicing in Georgia is $35,699, and across the nation is about $38,833. Benefits to choosing to be an EMT paramedic include the job as, in general, just the reward of helping people all day. It is also a very in-demand job as medical emergencies happen at all time, all across the country. And your training and growth potential as an EMT paramedic could lead you into various directions in the healthcare field. The requirements to become an EMT paramedic include a high school diploma or a GED and completing a 2-year program at an accredited university or school specifically for this training. For the job description of an EMT, on average, EMTs work very irregular and flexible hours. Sometimes this consists of an 8 to 12 hour shift a couple days a week, and other times it could be working 24 hours straight, followed by 48 hours off. In general, though, shifts are very flexible and variable and have a wide variety of scenarios on any given day. So for Josh Wright, the character, he is currently attending Emory University to get his master's in healthcare. He works the late night shift most of the week so he can take classes and earn his degree earlier. He is 24 at the moment and lives in a small apartment with 2 of his friends in the Atlanta area, right outside of Emory University. Josh Wright walks on the scene of the house, enters, and finds the patient passed out in the bathroom. There is stool in the toilet and there is blood in the stool. He recognizes this and understands that this is likely a digestive problem and the patient should be immediately transported to the emergency room so that they can figure out what further care should be taken. They load the patient up onto the stretcher, stabilize him by giving him fluids, measuring his heart rate, making sure he is in stable condition for transport, and then they drop him off in the emergency room where they meet.
Yana Feathers is the nurse practitioner working in the ER when the patient comes in. She is a nurse practitioner because her mother was a nurse and her hero, but she also wanted to have more autonomy in her work. In some states, nurse practitioners are even allowed to have their own practice. Her daily life consists of working her long hours at the hospital. She is married for 2 years and has no kids, but she loves to travel and hike. She's also 32 years old. Nurse practitioner is an excellent job because they earn about $100,000 as a base mean salary. And in some states, they are allowed to perform a lot of physician-specific duties. There are a lot of specialties, including acute care, family medicine, and women's health, to name a few. And the job growth and demand is high above average. The requirements to become a nurse practitioner include getting a bachelor nursing degree, which Yana got at UVA. Then you get a graduate degree, a Master's of Science in Nursing, or a Doctor of Nursing Practice program, a DNP. And then you are certified from a national board examination. Yana Feathers collaborates with a lot of professionals. She may need the doctor to sign off on her work, especially in Georgia where her practice is limited. And she makes referrals to other professionals and is focused on preventative care. In the emergency room, she and a doctor find the patient and stabilize him. They then recommend him for a CT scan, which shows a small inflammation in the small intestine. This is indicative of Crohn's disease, especially with the bloody stool. Therefore, a small bowel resection is scheduled.
Carver Stack is a certified registered nurse anesthetist who is going to be assisting with the anesthesiologist in the administering of the anesthesia for this surgery. He is 27. He got his bachelor's of science in nursing from The Ohio State University and his CRNA program through Augusta University. He's been married for 4 years, has twin girls, and a wife pregnant with a third child. He decided to become a CRNA because as he was working as an RN, which is a requirement to become a CRNA, he was inspired by nurse anesthetists to join that profession. In order to become a nurse anesthetist, you have to have a bachelor's of science in nursing, be a registered nurse, and have a minimum of 1 year of experience. After that, you attend a nurse anesthesia program and have to pass the national certification examination for nurse anesthetists. For his daily life, Carver really enjoys his family and his kids. He wakes up early to help make sure that they're cared for and loves getting back after work to be with them. So this is going to be an animation of a surgery. So here you can see that the diseased part of the bowel is going to be removed by the surgeons, and then they're going to rejoin the healthy sections. So prior to the surgery actually taking place, the anesthesiologist along with the nurse anesthetist explain how the anesthesia is going to be administered and how it works, and inform the patient of any complications that might arise even though they're unlikely. So Carver, as the nurse anesthetist, works with the anesthesiologist to administer the correct amount of anesthesia, which is dependent upon the weight and biological sex of the patient. During the operation, the nurse anesthetist and anesthesiologist monitor the patient to make sure that there's no complications that occur during the surgery and to make sure that they do not come out of the anesthesia early. And then after the procedure, they help to care for the patient as they're coming out of the anesthesia before they transfer that patient to a room in the hospital.
The patient is then referred to Heather Gray, a 30-year-old registered dietitian living in Georgia. Heather grew up in a food desert in Detroit, Michigan, where she saw high rates of adult obesity due to a lack of knowledge of how to incorporate fresh and healthy food into a diet. This inspired her to become a dietitian. She moved to Georgia when she was 16 and went to college at Life University, where she got a BS in dietetics. She then applied for a dietetic internship at Georgia Southern University, where she researched the best diets for individuals with Crohn's disease. Heather then took the CDR registration exam and got her registered dietitian license, which she must renew every 5 years. There are between 1,450 and 7,930 registered dietitians in Georgia. After getting her license, she moved to Atlanta with her husband, 2 kids, and dog. In Fulton County, the average annual salary for a registered dietitian is between $53,050 and $57,750. After coming home from her typical 8-hour workday, Heather likes to spend time with her family and she likes to do Pilates. Dietitians work with several other professionals such as surgeons, physicians, and nurse practitioners, and she may get patients referred to them to construct a long-term plan to change their health for the better. Working with the patient, Heather crafts a special diet for Crohn's disease. She suggests that his new diet includes low-fiber fruits, lean protein, refined grains, and fully cooked seedless, skinless, non-cruciferous vegetables. Once the patient is in remission, he should go back to Heather to craft a new plan that will fit his latest needs. Thank you for coming to our presentation. These are our sources.